1, 2, 3, and then you smile. Okay, 1, 2, 3, smile. Okay, one more time. We have more friends from Thailand. Okay, please turn on your camera, please. Wow. Hello, media team from Thailand. Wow. Hello, Sitira from CPI. Hello. Okay, I will count again. 1, 2, 3, smile. Okay, thank you very much. And okay, next I would like to announce a couple of items. The first one, the speaker will present one by one. After our speaker present, there will be an open for discussion. While listening, please mute your microphone. And if you have any question, you can text the question in the chat box. I will collect them and send to the moderator. We will record a webinar and share it on our website later. Lastly, at the end of the webinar, I will send you a questionnaire link in a chat box and your email. Please complete your feedback on the webinar through a questionnaire link. And then I will give a microphone to the moderator, Ms. Nanut from NSCO Thailand.
Good afternoon, everyone, again, and thank you for joining us the webinar hosted by National Health Commission Office Thailand on the role of government sector in multi-sectoral collaboration against COVID-19. This webinar is a part of a webinar series on multi-sectoral collaboration in response to COVID-19. We organized this webinar series because we have a question in mind that COVID-19 somehow reflects our solidarity. We work interdisciplinary across various stakeholders, such as government sector, NGO, civil society, and young generation. But we wonder whether we can maintain this spirit and this approach after COVID-19 or the future, another crisis or not. So this is the question. So I would like to stress here that we don't focus on how a country deal with COVID-19, but how they build multi-sectoral collaboration instead. And we have heard views from NGOs, civil society, and young generation from previous webinar. If you're interested in learning their view, we have a report posted on the website. And today we will hear views from government sector on the same topic. And at the end, we will have an imperfect answer on how to maintain multi-sectoral collaborations or how to make it sustainable. And our last webinar will present at the National Health Assembly of Thailand in December. And we will invite commentators from international organizations to complete this imperfect answer that we have helped build it up together. So please stay tuned with us and we will update everything on our website. And all right, we have 3 speakers from Bangladesh, Myanmar, and Thailand with me at the moment. As our announcer that has made it, the speaker will present their work only in 10 minutes to give background to all audiences. Then we will open the floor for our discussion. And if you have any question, please take us on a chat box and give your name and your country too. Shall we start from Bangladesh because the speaker came to the waiting room for a long time, and also the first person, Professor Dr. Golam Rabbani. He is a chairperson of Neuro-Developmental Disability Protection Trust. This is a government organization under Ministry of Social Welfare of Bangladesh. He has a long experience in collaborating with the government side and NGO side for people with disabilities, especially neurodevelopmental disability. So I would like to give a floor to Professor Rabbani, please.
Thank you very much, Namko, the moderator of today's webinar on the role of government in multi-sectoral collaboration in response to COVID-19. And I like to offer my heartfelt thanks to you and our other speakers from Myanmar and Thailand. I want to say something about my organization, Neuro-Developmental Disability Protection Trustee Board. Would you please show me the slides, Kanita? Neuro-Developmental Disability Trustee Board has been working to create an enabling environment for people with neurodevelopmental disability. This vision of the trust is to make the persons with neurodevelopmental disability capable to survive as a part of the society. The trust aims to provide persons with neurodevelopmental disability with physical, mental, and financial support. They are also paving way for them to acquire appropriate knowledge and skills for their empowerment. To achieve this vision, the Trust has taken various initiatives such as providing medical grant, skills training to caring of the persons with neurodevelopmental disability, early intervention of persons with NDDs, and arranging rehabilitation services, organizing awareness programs, so on and so forth. The Trust also has framed district committees of the Trust in every district, that is the 64 districts of the Bangladesh, to implement its various interventions for the betterment of the persons with neurodevelopmental disability. Our objectives is to motivate learning and sharing experiences, innovation of each sector in response to COVID-19, to raise awareness on multi-sectoral collaboration within country and between the countries, in the nearby countries, in order to handle the future crisis event, to seek answers on how to maintain multi-sectoral collaboration in post-COVID-19 and future other crisis events. What could be the outcome? To generate a webinar report on the role of government in multi-sectoral collaboration in response to COVID-19 in Bangladesh. Next, please. Activities for the multi-sectoral collaboration to reduce inequalities. Next, please. NDT Trust has provided emergency supplies, that is the food and medical grant, to 3,511 families of the persons with neurodevelopmental disability. Under NDT Trust close supervision, a guideline has been developed for the appropriate management to raise awareness among the persons with neurodevelopmental disability during the lockdown period. Lobbied with the member of the parliamentaries of the National Parliament and the relevant ministries to increase the budgetary allocation to combat the pandemic situation, focusing on education, health, social safety net, food security, online therapy, and psychological support according to both the International Agency Standing Committee and the guideline set aside by the Director General of the World Health Organization. A study on the impact of COVID-19 on the mental health of the persons with disability has been taken by me, that is the chairperson of the NDD Trust, and their parents of the offsprings. NDD Trust has facilitated a webinar with 15 ministries of the government and other relevant stakeholders on the response to COVID-19 for protection of persons with neurodevelopmental disabilities. A TV talk show has been broadcasted regarding the allocation of the budgetary provision and just mobilizing the financial and budgetary provision for the NDD Trust. Salary support to the non-government and private-owned schools, teachers of the staffs of the schools, those who are running for their NDD children. Key initiative taken by the government during the COVID-19 in Bangladesh. Next, please. Awareness messages on the COVID-19 have been disseminated through the different media, that is online and printing media. A different scheme has a ration card, financial support, Bangladeshi Taka 2,500 have been introduced to help the marginalized group in the country. The government took initiative to produce significant number of personal protective equipments from the ready-made garment sectors for the frontline health workers. The Prime Minister of Bangladesh announced $1 billion that is a stimulus package. Bangladesh government and the different non-governmental organizations installed disinfectants panels in crowded places. Safety hygiene materials have been distributed among the low-income group people. Medical facilities have been increased for the underprivileged people. Government took special measures to address needs of other marginalized groups even. What we learned, next please, what lessons we learned? The lessons we learned is that multi-sectoral collaboration is mandatory for sustainable development. The engagement and collaboration of government and non-governmental organizations, ministries, and other relevant stakeholders are proven to be effective in crisis situations such as COVID-19. Multi-sectoral collaboration has been benefits such as increasing access to resources, sharing responsibilities, and strengthening ownership of activities by stakeholders. The engagement of multi-sector creates new knowledge, experiences, and resources, which is benefiting for producing better outcome during crisis situation. I do like to snapshot few things which we have done the relief materials by maintaining the social safety and the public health safety measures, that is the food grants and the relief materials, at least in 5 terms, including the festival grants, that is the hard cash, and the new clothes on the Eid al-Adha, a very big festival, to make the people elegant and feeling good to celebrate their this Eid al-Adha festival. So thank you very much. And if there is any question, later on we shall discuss. Thank you. Thank you very much.
Thank you, Professor Rabbani. I think I will not ask the question at the moment, but I would like to hear from all speakers and ask and start discussion at once. So can I move to the next speaker from Myanmar, Dr. Kyaw, Deputy Director General of Minister Office from Ministry of Health and Sports. He is one of the busiest men in Myanmar because he is responsible to deal with COVID-19. May I invite you to give a talk, please, for 10 minutes.
Thank you, Nanit. So, thank you, the organizer, and also the moderator, and all other responsible persons to arrange this video conferencing arrangement, and also allowed our on behalf of our ministry, allow me to present about the Myanmar experience about the COVID-19. So, the good afternoon, everybody. Next slide, please. Next slide, yes. So my presentation focus on the 4 main areas. Next slide, please. So everybody knows that total population of the Myanmar is nearly 56 million. Foreign with the India, China, Bangladesh, Laos, and Thailand. Today area is 676,578 square kilometer. So compared with the Texas, it's a little bit smaller. So the capital city is Nepido, located at the central plain area. And according to the ethnic diversity, mostly 68% is Burma, the 9% Shan, 7% Korean, the 4% Khaing, 3% Chinese, 2% India, and 2% Mon, and 5% other. According to religious, 87.9% are Buddhism, and 6.2% is a Christian, and 4.3% is a Muslim, and the rest are the animist, Hindu, and other. Next slide, please. Yeah. So as of 28 September 2020 today, laboratory confirmed case is 10,734 cases. Today death is 226 among the confirmed case, and recover 2,862. So that I show the diagram. So the abruptly increase to the number of cases like a tsunami wave started from the 22nd August. So I guess nearly 9,900 are increased abruptly. Next slide, please. Yeah, there is a timeline for the preparedness. So I will highlight some points. Our ministry is noticed from the ratio 0 and also the RCA+3 office about the unexplained pneumonia cases in the Wuhan city, China on 4th January. So on the 8th January, our emergency preparedness meeting, the chair by the permanent secretary was full. On the 19th January, so we received the information about 192 cases and 3 deaths in the Wuhan, China, confirmed the virus can spread between the human. Starting from that point, we prepared the necessary thing. On 24 January, the ministerial level coordination meeting of the Emergency Operations Center, London started to establish. So that on 25th January, His Excellency Union Minister visit to the preparedness site at the airport and the Weerasak Specialty Hospital in Yangon. So on the 28th January, first meeting of Inter-Ministry Working Committee chaired by the Permanent Secretary, and this is the first day meeting of the MOHS guidance to the state and region. So on the 30th January, the ratio declared it is a public health emergency of the international concern. So on 31st January, first PUI case detached at the point of entry at Yangon International Airport. So on 1st February, we evacuate the student who attending the different university in Wuhan, and we also suspend their visa on arrival. On 10th February, so meeting of the Central Coordination Committee, the chaired by the Permanent Secretary of the MOHS and MOFA, with the related ministry, State and Region Social Minister was holding. On 20 February, the Clinical Management Committee established. On 28 February, specified the COVID-19 as a notified disease so that we ban the mass gathering. On 1st March, the Union Minister chaired the Central Committee meeting on the preparedness for the detention. On 6th March, released management protocol and clinical management guidelines for COVID-19. And 11 March, the ratio declared COVID-19 is a pandemic. On 30 March, National Central Committee for the Committee to Prevent, Control, and Treat COVID-19, chaired by the State Councillor, formed working committee to address the possible impact of the COVID-19 in the country economic established. So I will jump the some steps according to the time constraint. So on 23rd March, so we did the first laboratory confirmation case. So we detached the first laboratory confirmation case in the Kachin State, Kitay. He is a Rabbani from the America. On 30 March, COVID-19 Control and Emergency Response Committee, led by the first Vice President, established. So the end of the March, we can distribute the contingency plan with the Myanmar language to up to the grassroots level. Then April, according to the racial classification, cluster of case, start testing at all the contacts and quarantine people, about 5 to 10% of the total quarantine people. So on the 28th April, we could establish committee to coordinate and collaborate with the ethnic arm organization to prevent, control, and treat COVID-19. So during the June, so we can prepare anything necessary, and also we announce a restriction of the population movement, and also to do the lockdown to the some townships in Yangon city. So the end of the July, so we erase all the townships that have been already locked down in Yangon. But starting from the August, exactly is the August 20, so we start to detach the COVID positive case in city. So we announced stay home at the city township in the Khaing state. On 26 August, so we announced all the townships are related with the stay home criteria. On 1st September, so the lockdown and stay home started again in the Yangon. So with the 7 townships. On 9th September, we announced lockdown and stay home at the 21 townships in Yangon region. So now all the townships except Kuku Island township, so under the lockdown arrangement. Next slide, please. So according to the leadership and governance, so we established the national level central committee for COVID-19 and the prevention, control, and treatment, chaired by the state councillor, and of which thoroughly control to the regional and state level committee on COVID-19, chaired by the chief minister. Under the national central committee, so we formed the COVID-19 containment and emergency response committee, chaired by the vice president one. So this committee coordinate laterally with the economic remedy committee and also the head, the Ministry of Health and Sport. Under the Ministry of Health and Sport, we highlight the 3 units: epidemiology, the health service promotion, medical care, and clinical management. So this is the leadership, political leadership and commitment. Her Excellency State Councillor chair the national committee, and also the massive encouragement to the community involvement, and also national. She lead the national volunteer CRA unit, and also community-based facility quarantine, and she arranged the mass campaign and to show the demonstration of the step for systematic hand washing, and she arranged weekly video conferencing with the listen the people voice. Next slide, please. During this period, we could publish the National Action Plan on Health Security and also National Health Sector Contingency Plan with the both Myanmar and the English language. And also we can develop the COVID-19 Economic Relief Plan. Next slide, please. So I will skip this slide. Yeah, there is a Sam memorial picture. So the upper left corner is our minister, union minister, chaired by the inter-ministerial committee. So through the video conferencing, he interacts directly with the state and region health department and also the different hospitals around the country. The right upper corner picture is taking the sample as a quarantine site. Lower left is screening a point of the entry in the ground crossing, international airport and the seaport. Lower right is the quarantine. I think that there is a monastery to arrange as a quarantine site. Next slide, please. During the reporting period, we got developed about nearly 120 different material for the risk communication from our health literacy promotion unit. Next slide, please. The previous slide. So I'm at the lowest, but with the light blue color is a website name. So everybody can visit to our website for any necessary information related to the COVID-19. Next slide, please. There is a whole of the society and whole of the government approach. The immediate response, like a triangle, governments, private sector, and civil society, and they're very closely working together. So during that period, we could develop the recovery plan with the 7 goals. So the mainly focus on the not only during the COVID-19 response period, but also the post-COVID-19 time. Next slide, please. Yes, there is what Myanmar has learned from the COVID-19 response is that, next slide. The leadership and governance play a critical role in pandemic response. And also we need the harmonious intervention among the different ministries, especially Ministry of Health, General Administrative Department, and Police Force, and also the Ministry of Social Welfare. Next lesson learned is not just a health emergency. Social, economic, and political view is a really matters. The lesson learned is a significant investment in the health emergency response preparedness. And the last one is strengthening health system, especially universal health care. Universal health care, including the access to the universal medicine, is a very important thing. And also the social safety net is a very important. There is a lesson learned during the COVID-19 response. Thank you for your attention.
Thank you very much. Your presentation is very well encompassed and especially show the balance between health and economy and other social sectors. I would like to move to Thailand. The speaker from National Health Commission Office, Dr. Weerasak Putthasri, Deputy Secretary General of Thailand National Health Commission. I would like to invite you to give a talk, please.
Thank you, Nanut. Good afternoon, everyone. It's clear. Okay, I will start. I will present the experience of Thailand for the COVID-19 in Thailand on behalf of what the government sectors have done so far for the COVID, and what is the multi-sectoral collaboration consequently after the government sectors. Next, please. Next, please. Okay, you may know that Thailand was ranked the highest in the global survey of its effectiveness of handling for the COVID-19 recovery from the crisis. The global indications published in July, and Thailand has an index score that putting at the top of the global chart. But we have to learn from ourselves what we have done and what happened in Thailand that I would like to share it with you. Next, please. Okay, I will start with the governance and multi-sectoral action in Thailand. Thailand has responded to the COVID-19 under the national plan, the national strategic plan for the emerging infection disease endorsed by the cabinet. This strategy is aiming to formulate the proposed national policy and strategy for the preparedness, prevention, and control of the disease in Thailand. It is the backbone guideline that we implemented. The guideline is including 6 strategies. First one is public health emergency preparedness. The second one is surveillance, prevention, and control with the One Health policy. The third one is the enhance the public information and communications. The fourth one is the collaboration in the country, international and regional and global as well. The fifth one is multi-sectoral, private sector and provincial participation. Sixth one is the research. I will focus on just only number 2, number 3, and number 5. It's quite linked together. Next, please. Yes, we start with integrated working among government agencies first. Under the Communicable Disease Act 2015, the provincial governors, the governor of each provincial, has the chair of the Provincial Communicable Disease Committee with multi-sectoral membership, whereas the provincial chief medical officers is the secretariat, is a technical secretariat. The governor, the provincial governor, has convened daily meeting with the committees, even though they don't have any case in their province, but they have the meetings. The emergency operating center at the Ministry of Public Health report recommended policy and regulation to the center and send the message to the provincials. Next, please. For the health communications, we start in the January. We have the official advice to the public for the self-protection methods, including regularly washing hands, wearing masks, do not touch eye, face, and mouth something, and avoid contact with the patients, and do not share the personal belonging with other, and eat hot and fully cooked food. In Thailand, we have the motto of eat hot food, use a serving spoon, and always wash the hand is the motto of the campaigns. Next, please. Okay, I will move for the wearing mask. In February, the Ministry of Commerce, they include with the surgical mask and to include the mask in the list of the control product categories. So the retail price, the distribution, exportation, and stockpile that includes and under control. The Ministry of Public Health has authority for the central procurement for the essential resources and distribute to all public and private health facilities. The private sector as well. The private sector and local production of the mask, they have the role to increase or scaling up the production of the mask from the 1.5 million to the 4.5 million pieces per day. That is solving on the shortage of the problem. Next, please. In the early March, the fabric mask was recommended of the alternative for the general population, not for the doctor. We have the information and recommendation for the fabric mask, such as how to do it yourself, how to wash your mask, how to clean your mask, and how to reuse that, etc. The Thai people also donate something for the PPE and surgical mask to the public sector as well. That is a good example of how the people can contribute to the health sector. Next, please. For the communicating informations, start with in January, the situation awareness team, SAT, of the MOPS, Ministry of Public Health, reporting the situation of the coronavirus infection daily. And the daily information is confirm how many cases, how many days, how many patients on treatment from all provinces in the country, synthesized into the national reportings. The team is also convened by the provincial office. They spoke the same number to minimize the conflicts of the number to give the message to the populations. On March, the Thai government established the information center, integrate all information that form all dimensions as well. Information, public health, economy, and society in order to address all public concern in timely administration. Next, please. Okay, for the main function of the information center are to compile all information from all relevant sectors and gather the concern from the people from the private sector, collaborate with any related agency to address the concern and inform the people, inform the private sector to work together along with the social, the public. The village health volunteers and local public health practitioner where East Province, they work together as a team for the communicating situation and public health awareness in the public as well. Next, please. Okay, for the physical distancing or social distancing, for example, of the self-isolation, stay-at-home campaign, something like that. For the public communication about the physical distancing has been translated into the common phrase and billboard campaign nationwide for the social distancing in many channels. with the stay home, stop the disease for the nation is the campaign officially. And it is a quite excellent undertaken by the Thai populations. The people are encouraged to stay at home, working from home, and keep physical distancing about 1 or 2 meters. Wear clothes or wear clothes mask, something like that, and wash hands, something. This is a national campaign is well received from the citizens. It's good. Next, please. Okay, for the physical distancing, we restriction of the non-essential business, working from home and close some sector. The private sector work from home is encouraged to do that with the government sector as well. And restriction on the mass gathering in the public place, event, sport, event, or close. That is the promote of the physical distancing. Next, please. As I present above, we see the power of the active citizens. Everybody have a power. Everybody have the function. Everybody can contribute to the community. We see the active community. Community is the gathering of the people. We see the active of the society to work together to fight for the COVID-19. Next, please. I will close my presentation is to establish the multi-sectoral collaboration. We can start with the government. The inter-sectoral actions is not just only for the health or the disease, but we can expand the actions to the food, supply food, like the Bangladesh and Myanmar as well. The economics, they lost job, they no money, something like that, and also many aspects of the quality of life have implemented in the community. I would like to end of my presentation. Thank you.
Thank you very much. I think we have a good combination of speakers because we mentioned about the national level, while Thailand also mentioned both national and sub-national level, which is he mentioned about provincial level. And then Bangladesh talking about national level, focusing on the vulnerable group. So we have different pictures from 3 countries. But I understand that this is just the aspect that you want to present, but not cover all what you have done in the countries. But apart from the picture that you have shown us, in the sense of perspective that you have shown us, what strikes me is you already give us an answer for how to make multi-sectoral collaboration workable, because you already mentioned law, which is laws which already came before COVID-19, for example, Communicable Disease Act. And second one, you mentioned about mechanism, both at the national level as well as the sub-national level, which somehow is already exists before COVID-19, and some mechanism just established in response to COVID-19. Secondly, you also mentioned about the plan, both in response to COVID-19. You also mentioned about the guideline of procedures on how to implement the policy and plan, especially for the vulnerable group. Maybe you need a guideline, specific guideline, not for them, but for other organizations to support the vulnerable group. You mentioned about information center, you mentioned about communication, which is all of these other factors. But I would like you to think of what else we need to make multi-sectoral collaboration workable. I just put out, map out keywords from all of you. Can you give more example or other factors I throw this question to all speakers, and I don't mind who's gonna answer first. What else we need to make multi-sectoral collaboration workable? Seem 3 countries work very well, but I would like to hear more what factors. And I'm happy if the participant would like to share your view as well, because this is not, it's more like consultative meetings.
Hello, Nanut.
Please,
May I share my idea first?
please.
What else or what factor that we can use the collaboration among sector is the since for me and for Thailand, since the COVID-19 is not normal situations. This is the urgency, is the affects every sector, affect every single people, so that is well accepted as the health problems and the social problem. The situation need the in Thailand is the solution of this one. It need strong political commitment from the government with the effective command. Yes, it, the government sector combined with the coordination of the people of the I mean the coordination function of the people sector that can be linked between the government and the civil society work together. The role of the government, I think, in the COVID situation, we start with the government body to set the country directions, and can synergistic intervention for all sector together with the single direction. I think it's a good example. Obviously, in Thailand, we have in the implementation level, in the local level, we saw many innovative from the communities sharing information among themselves, helping the government for the disease surveillance, support food and mental support for those who have to be quarantined themselves at home or the community facility as well. I think we can use this lesson learned to build the multi-sectoral collaboration to be feasible. That is my thinking.
Thank you. Can I move from the previous webinar? They mentioned that to make multi-sectoral collaboration successful or workable, it depends on the common goal. If everyone have a common goal, and is this possible in the sense of this crisis? Everyone has the same goal to fight against COVID-19. But I wonder if the situation of COVID-19 is getting better. Can we still maintain multi-sectoral collaboration? For example, Thailand and other countries are going to reopen the countries, welcoming international tourists or expats to come to the countries. How could we still do collaborate with other ministries or other stakeholders still to fight against COVID-19? And I would like this question from Myanmar. So I would like to ask all 3 speakers to share your view, please.
Yes.
Go ahead.
Can you hear me?
Yes, please.
There is some noise. There is some noise coming. There is some noise coming.
Yes, but I think
There is some noise coming.
all panelists mute their microphone. Oh,
There is some noise.
it might be from your side.
এটা গানের শব্দ আসতেছে এখানে।
The noise is from your side. Right now, Dr. Rabbani still have an audio problem. So I would like to ask other speaker to respond to my question, please.
Yes. Can I respond?
Yes, please.
Yes, the multi-sectoral collaboration sustainability is very important. Not only during the response phase, but also the post-COVID period time, because nobody cannot predict when COVID situation will finish. But after COVID, we need to do a lot, not only the health sector, but also the economic and other social development. So we have a platform. There is a development partners collaboration platform. So the lead by the Ministry of Health and Sport, and also the partners are the UN agency and the donor countries, and also the NGOs. So based on these platforms, so starting from the logistic mobilization and the distribution, and according to the needs that we already calculate in our contingency plan. So based on that information, so these the multi-sectoral collaborative committee to mobilize the necessary logistics, and also that they assist in the not only the logistic area, but also the quarantine, and also the risk communication, and also the treatment. So, and I already explained that these multi-sectoral collaboration need to sustain not only during COVID time, but also the after COVID period. So that we need to rehabilitate so many areas, so that we have so many lessons learned, so that we need to negotiate these the rapid and some misunderstanding, and also that we need to share the right information in the right time to the community, not only the community, but also our the implementing partners. That is a very important. So this is our experience. Now we are solving the problem. So we have so many information gap and so many problems, especially as a quarantine side. So in quarantine side is not only health sector, but also the general administration, police, food, and other well-wisher and the volunteer. So who will lead the quarantine area is very important. So the leader is need to implement according to the criteria and guidance of the committee. So my understanding and the what we are doing is now is there is the sustainability of the multi-sectoral collaboration. Thank you, Nano.
Thank you very much. May I ask other speaker, do you have any comment on this? Okay. Professor please unmute your microphone, please. Professor Rabbani. I guess the Wi-Fi connection in Bangladesh it is not stable. Could you try again, Professor Rabbani? Thank you, Professor Rabbani. May I? While we're waiting for Dr. Rabbani audio system, may I ask the participant to, I have a couple questions from the participants. Can I ask Dr. Suwaji from CRO, could you turn on a camera and ask the question by yourself so you can share your idea or question with the panelists?
Thank you very much, Kakunanut. Can you hear me properly?
Yes.
Okay, thank you so much for all the speaker. You have given us the very excellent presentation. What is important is also we want to learn that if the country faced with this kind of emergency, even during this time, without a law, without a proper mechanism, maybe at the US subnational level, what could be your best suggestion to bring the multi-sectoral partners together? And what do you think would be the most effective ways to engage with people in your country context? What trigger people participation in the COVID-19 response and beyond? Over to you. Thank you.
So this question to all speakers.
Sorry, Nano, this is Kyaw. The Professor Golam Rabbani has some technical problems, so he is trying to connect again. So now he is trying to connect from his mobile. So we need to need some time for him.
That's fine. We wait for.
Yes, can you hear me?
Yes, perfectly.
Yes. I have in my speaker's profile, you know that we have my government after in Bangladesh, the COVID a pandemic started in 6th of March. And the government immediately called cabinet meeting, and they called all the NGOs. You know, Bangladesh has both international and national NGOs. And they are working in the field level, including the UNICEF, World Health Organization, and other local NGOs like CDD and Seed Trust. And all together they sit and they find out the strategy how to combat this COVID situation by mobilizing the resources and starting from the city areas where the population very dense, particularly the 8 divisional cities, and they all together put the country into lockdown, and they are finding, you know, we have our this public health policy, and the government has the acts to prevent the communicable and non-communicable diseases. So they very immediately formed a government, a very high power committee by putting together the experts from the medical side and from the NGOs specialists, those who have enough experience in terms of natural calamities, and in various times they have their vast experience. And they all come together, and now they are providing their effort both in city areas and the remote rural countries. And you know, Bangladesh, most of the places are the plain land, and we have our hilly areas in the east and southeastern part of the, and the northeastern part of the country. So starting from the ethnic and the normal population group, and all caste and the religious or any sort of thing, all people are together. The social leaders, the politicians, and the other active and the actors, they came together to fight against the menace of the COVID. And we are trying to help each other. And now the country is a bit stable, and we are now in force with the maintaining the social safety measures and the public health measures. Our transport system is moving all in all the cities and the remote areas, and the food production is okay. And most of the rural areas, particularly in the villages, there is less COVID situation or pandemic. And you know, Bangladesh has lots of people working in Europe, particularly Italy, France, and European countries. And during starting the COVID in European countries, sometimes they have canceled their work permit, and people came to Dhaka with infected conditions, and that we have very nicely managed by coming into the airport, and we have segregated them. We have done them in quarantine and isolation, and we are by opened a lot of hospitals, COVID dedicated hospitals, and now we are in a very controlled condition. And what Thai friend has told, that's government is the people, by the people, of the people. So public and private sector mobilization and resource mobilization, and working hand to hand with the non-governmental organizations in the cornerstone of the success of multi-sectoral collaboration. And government of Bangladesh, you know, in every week, Prime Minister used to call the cabinet meeting, and we are very actively and very keenly observing the situation, and the death rate and the new cases are coming down very effectively. And we are now in a, what you call, more or less, it is now in a tolerable situation, and we are finding important achievement gradually. So this was my point to tell.
Thank you. Can I repeat the question from Dr. Suwaji again? In case, let's say that in case that we, in these three countries, if you don't have laws, you don't have mechanism before, what would be your best suggestions to have multi-sectoral action start from your country context?
What lesson we have learned from this webinar? Can you hear me?
Say again, please.
What we have learned from this? Can you hear me?
Yes. Yes, I can.
Yeah.
Hear you.
Yes. What we learned from this webinar discussion from the Myanmar and the Thai friend, active participation from the citizen of the country, as because if people are not aware about their health condition, and this COVID situation is such a situation, very nearly we do not find any solution of vaccination. But we shall have to live with this crisis, and we shall have to maintain our safety measures and keeping pace and trying to maintain our development in terms of in agricultural sector, in industrial sector, transportation, and person's safety by maintaining the high safety measures of their personal health. So every sector, in Bangladesh, we have our 15 ministries, big ministries, starting from the public administration and the health sector and the social welfare ministry and the education ministry. You know, all the educational institutions are still closed here in Bangladesh. Although in university level and school level and college level, we have just maintaining our online education, but there are some flaws in between us because there are some gaps, but still then we are very able, as because you know, we have our smartphone connection each and every corner of Bangladesh, that is and this Wi-Fi and online system, we are just connecting the students from the school, and we are just maintaining our academic activities and the examinations in college and university. And in school and private primary school level education, it is a bit difficult as because the children, they have their less amount of attention and concentration, and they are not feeling good as because if they don't feel the actual presence and the touch of the teachers, they cannot feel good to go for the study. So we are trying to find out the ways and means by discussing with the guardians, discussing with the parents and the teachers and the school authority and the education ministry to go forward with this educational atmosphere in this COVID situation. And this is a very big need of multi-sectoral collaboration. And without multi-sectoral collaboration within country and amongst the countries, and we can learn a lot of things from your side, from the Thailand and the Myanmar, and we can implement this technology and the know-how to our place, and we could be better off this tackling or the managing the situations.
I thank you very much.
Thank you.
Dr. Weerasak going to say something.
Okay. Okay, Nano, thank you. I would like to respond to the Dr. Suwaji or combined with the Misu from Myanmar and Kamal that I read from the chat. I think the same vision that how to make it happen of the multi-sectoral collaborations. For me, it seems it is not possible to have multi-sectoral in a day or overnight once the crisis comes. But fortunately, people in the community, for Thailand, people in the community, they have their own experience of multi-sectoral tools and platform to solve the problem. We have the health charter, we have the health assembly in the local level to concern about their health in the sub-district level and something like that. So this is the platform to building their capacity for active community and making, trust of working together in the normal situation. It is quite crucial ones in order to prompt respond to such crises. That means the government can take for the COVID. Once the government take lead for the sending the strong message or signal, so why the community, why the all sector, they can work together for the COVID. This is from a Thai experience. I would like to pick up some question from the chat box. That Kamal say something about the quality to ensure the face mask for the government. Actually, we don't have the quality control for that one. But intervention, the social intervention that we have is all shops or department store. They are allowed the customer just only who wearing the mask only. And we have we have the mobile application scanning before checking in and checking out any place they visit. This is an intervention the people can use that one. You see in the Thai community. And Situla have a question of that, how Thailand government preparing for reopening the country in the multi-sectoral approach. It's challenge for us for the Thai government prepared to reopen the country starting in October, starting with the long-term residents or investors under the quarantine regulation. We have to balance between health with the control of the acceptable new case, I think something like that, with the other sector like economics, tourism, something we have to balance. It needs all sector to comply regulations, at least for the surveillance, at least for the to comply for the regulation of the how to enter your shop or something like that. We use the same thing with the Thai population. I think it's quite challenging for us, but we have to learn. Yes, that is from me.
Any speaker would like to respond to the question from Dr. Suwaji? Or otherwise, I will go to another question. Okay, so there is a question which the participant has left already, but I would like to raise this question to all speakers. Does the bureaucratic system of the government become an obstacle to apply multi-sectoral approach?
Yes, I can respond.
Please.
Yeah, the bureaucratic system is sometimes it's a big hindrance and it may be a barrier sometime until and unless the bureaucratic system is open-minded. The bureaucracy should be the servant of the public. And if their mindset is not like that, and if always they follow the criteria, And criterion-based things usually do not work in crisis situation. So if the NGO people and those who are working in the grassroots level with the people, and if the local government system is not strong, and if the demand from the public or demand from the private sector and the people doesn't come, and I think those who are activists from the normal and the ordinary people, those who are the taxpayer, they should have to have the right to tell about their health facilities and their demand for everything. You know, country like us, if you go for a full lockdown or very stringent sort of lockdown, then the economy will be just locked, and the country will be in a fix, and the financial and economic condition will be very problem. As because, you know, most of the people in the rural areas and in the city areas, those who are low income, they maintain their day-to-day fooding by doing work. But if you totally ban the this movement of the people and very stringent sort of this social things of do's and don't do's, then that will be very difficult from living their life in a healthy and satisfactory condition. And their knowledge of the people about the public health is still very, I think, not clear to them. Why do we use the mask? Many people, they don't know about that. So the public health is a good machinery, and the NGO people, because they are working very close to them, they can at least play a very vital role to make them understand that this infection of the COVID-19 goes through the nose, and it affects in many ways, but particularly the entry of the disease is through the oronasal and the eyes, the ears, and the mouth. So this knowledge, ready-made knowledge to the public is very essential. And until and unless the people, those who are less educated, and they don't understand the consequences and the comorbidity of the disease condition. So nowadays, scientists are telling that this COVID is not a pandemic only, it is a syndemic, as it has a social connotation. And these comorbid conditions of the persons, the elderly persons, the vulnerable group, and those who are suffering, those who are the people with the disabilities, in all sorts of disabilities, particularly neurodevelopmental disabilities, elder population and the disabled population are more susceptible to be affected by the COVID condition. So these sorts of knowledge to be given to them, and it needs a very strong collaboration. Until and unless these downtrodden people from the rural areas not well educated about this, so the success of the COVID-19 maintenance and this survival and the protection is a very condition in jeopardy. So we shall have to find out the ways and means to find out the magic bullet. That magic bullet, one is the vaccine, and the another is the personal protection by using the protective equipments, personal protective equipments, and plenty of supply. You know, Bangladesh has a lot of ready-made garments factories, and it has been produced. But the people do not know what is the use, how does this infection goes into human body, and how it spreads. This is still, there is a lot of misnomer and a lot of myths. So we shall have to overcome these things from the upper level, that the bureaucracy level to the political level, the political commitment, and the member of the parliaments and the local government system. that we have our sub-districts and upazila and the union level, where the village headman, they used to control this, the people's mind, and the religious leaders who used to listen to them. So they should be well aware of this thing. And the success depends totally on this multi-sectoral collaboration, particularly all sorts of people, from the imam of the mosque, the village headman, and those who religious leaders, just like the monk of the Thailand and the imam of the mosque of the Bangladesh. These people should be categorically given knowledge regarding the prevention of this COVID-19 situation, as because this is a very contagious and very infected condition, and the spread of the this contagious condition is the prime factor and the prime role and the main and the sole secret of combating the COVID situation by and through the multi-sectoral approach. Thank you.
Thank you very much. But I would like to ask this question to other speakers as well. Does the bureaucratic system of the government become an obstacle to apply multi-sectoral approach? What do you think?
Hello?
Please go ahead.
Yes, I'm Weerasak. I would like to mention something about the bureaucratic system. I think the bureaucratic and government will be is quite bureaucratic. I know we have to accept them. But for the COVID is the emergency of the state. We need something officially, and follow the rule of the budgeting, support, and officials information, something like that. Sometimes we face with the bureaucratic manners. For example, of course, in the pandemic, we found the infodemic with some information usually happen in such circumstance. That's why the government set the information center providing information in daily basis. I understand the bureaucratic of the manners, but we need it. But we need only the policy, not the implementation. That's why the central government they decentralize the implementation to the provincial governors. The provincial governor has authority and decide any intervention in their own provinces with the consultation of the multi-sector participation in the provincial committee. I think if we can combine the bureaucratic manner of the government by just send the signal or the policy, but the implementation, we need more flexible, we need more inclusive of the all participants working together. We don't use the bureaucratic manner of the government for the implementation.
So
yes.
We government for policy, but in terms of implementation, we need a multi-sectoral level at the policy level done by the government as well. But implementation is also, we need multi-sectoral collaboration, but more inclusive, more include stakeholders. Which this is the message from Dr. Weerasak, Thailand. Doctor, I wonder, Dr. Kyaw Khan, would you like to share your view, please?
Yes, yeah. Our standing as a community is very important. Without community participation, we could not respond to COVID-19. We have a communicable disease law, and also COVID-19 is a notifiable disease. So better we try to educate the people with the right information to reach the right time, so that we develop the ministerial dashboard during the second week of February And also that we established a call center during the second week of April. So from these two areas, community can receive the right information. And also from our health literacy promotion unit, we developed so many risk communication materials, or I already present, nearly 120 material we have been developed. And every risk communication material, every knowledge, we translate with another the ethnic language. So that usually we translate to the nearly 33 language. So every the higher education material. So actually we don't want to do any restriction and any lockdown, any social distancing, but for the race, there is a highly infectious disease, so that we educate first to the community, followed by the policy and the regulation that we, and currently we are using the policy of the lockdown, and also the how to tell the in my presentation I highlight we have a central committee for the response and the prevention, response, and the treatment committee. So under the central committee, we developed the containment emergency response committee. So the containment emergency response committee is chaired by the vice president, and in which committee all the minister and also the deputy minister, especially they need to involve in the containment and the emergency response. So from which committee they set up the any necessary regulation to the top down up to the township, and also the smallest administrative units we call the village and also the wards. So according to the guidance of this committee, so we do the contact tracing and also the rapid reporting and also the quarantine. So the most of the frictions occur as the quarantine area, because some of some of the people who need to do the quarantine is they don't want to import actively and also willingly, so that always they would like to blame. So currently we are using the quarantine, the policy is a facility-based quarantine. So from the government side is we arrange the necessary thing at the quarantine with the participation of the volunteer and also the well-wisher. But the very few percent, some of the people they complain at the very beginning stage. So such kind of the friction is we educate and we coordinate with our head staff and also the local administrative body and also the volunteer. So finally, whatever it is, we could overcome any friction. So that my understanding is we need to advocate, we need to educate the community is very important. Without community participation, is we cannot overcome any friction, any problem. There is our understanding and also we are using currently. So we don't want to use according to the law and regulation. The first we educate the community first. There is our policy are currently using for the community participation. Thank you, Nanut.
I think that question we cannot say yes or no in terms of bureaucratic system is an obstacle to multi-sectoral collaboration or not. It is hard to say yes or no, but right now, as Myanmar and Bangladesh, as well as Thailand mentioned, that there are more collaboration with community, with other stakeholders. So somehow we have a good sign already to work across stakeholders and across sectors like not just health work within health, but health work with agriculture, education, and trade. And also Myanmar mentioned about community engagement, highlights on that things. But I have a question, two more questions. One from Mr. Akram. Are you still there? Can you turn on a camera and ask the question by yourself, please?
Yes, I am here. This is Akram from Bangladesh. I am working in a non-governmental organization in Bangladesh. I would like to know is there any legal basis for the multi-sectoral collaboration in Thailand? Or it is one kind of a commitment of the government, or how the government is collaborate with private or non-government organization? These are the main question, as well as in the, I also wrote in the chat box, and how the Thailand government is controlling the quality of the face mask or the hand sanitizer. In Bangladesh, we found the many type of the hand sanitizer and mask is available in the local market, but there is a question about the quality, whether it is good or perfect or not. This is my initial.
Right. Thank you. You asked two questions, but with the time limit, I would like to pick up just one question. And this question to all speakers, if you can, is there any legal basis to build or to strengthen multi-sectoral collaboration in your country? Maybe it's not necessarily about health, but it could be other law.
Others, yeah. Thank you. Thank you, Namatsa.
Can I respond?
Please.
Yes. In Bangladesh, these NGO, those who are working non-governmental organization, they work under certain legal frame. And without the regulation, no system works properly. So in my country, the sectorial collaboration, we have our certain policies and some laws. So they should abide by this political framework and this legal basis, and so they work very harmoniously without interference or without any interruption of their work. So definitely there is some legal and some political and policy basis. So no NGOs and no persons, those who are working with the people, cannot work with their own. And you know, regarding the PPP, that is the personal protective equipments, we have our industry inspection, Inspector General of, that is the inspection, that is they used to look after the industries, their quality of production. So quality assurance is very important, and it is there in my country. And you know, this ready-made garments factory, those who are producing the PPE, and they're exporting outside Bangladesh. And definitely the other countries and the countries who are purchasing this PPE, they are also, they have their quality assurance. And we have our international bodies. That is most of the garments it is exporting in the European country and the other countries, including Russia and other Central, Western and Eastern Europe, and even in United States of America. So they have their international agency to look into the quality, and we have our internal inspection, the Inspector General of the industry. They used to assure the quality of this product, that is the personal protective equipments. So, and we have our other, that health ministry, they have also this, and we have our industrial sector. And whatever production you do, we shall have to go through this process of quality assurance.
Can I go to, may I go to Thailand first, followed by Myanmar? Is there any law or legal basis to strengthen multi-sectoral collaboration in your country? Unmute, please.
Okay. No, thank you. For Thailand, I don't think we have the special legal for that one. But for Thailand, I will give you some example of the National Health Act. National Health Act, we have the National Committee chaired by Prime Minister. The committee is come from the government sector, academia, and professional, and the people sector in the equal basis in terms of number. Any policy proposed and discussion in this board, they set the agreement is that the participation is important. So that why any policy we need multi-sectoral discussion, implementation as well. Every year we have the National Health Assembly. The assembly is the platform for Thai people to discuss among sector for any health concern or something like that, to find the resolution together and implement together. I think this platform can help us how to learn how to work with the multi-sectorals. This is for Thai experience, maybe useful for your context, like that. Thank you.
Thank you. May I ask Myanmar, please? Yes, please go. Unmute, please.
Yeah, thank you, Nanot. Yeah. So in Myanmar, we have a communicability law. So any emergency situation, especially for the health, so that COVID-19 is a public emergency. So that and also that this is a notifiable disease, so we could use a communicable disease law. So according to the communicable disease law, we found the committee, the required committee. So the big highest one is a central committee, central control committee, and under which we develop the necessary committee. So for the multi-sectoral the collaboration, so in our presentation, I show the contingency plan, in which we mention very carefully and very the detail about how to develop the multi-sectoral coordination committee up to the grassroots level, especially township level. The mainly focus on the three areas: administrative, clinical management, and the supported. So in the supported committee, so not only the health personnel, not only the administrative body, but also the CBO and the local, the well-known people, and also the local representatives included. In the clinical management committee is chaired by the highest the rank from the health sector. The township level is a township medical officer is the chair. At the state region level, it's a state. The region head director is a chair. At the central level, the union minister is chair. So that we have a different and also the different level of the multi-sectoral collaboration body. In our contingency plan, is we clearly mention how to develop the multi-sectoral coordination body. It is the started from the when the Ministry of Health has announced there is the pandemic, and also we need to use the guideline of the communicable disease law, from which we expand and develop at all the level. So that In Myanmar, the answer is we have a communicable law. Based on that, we developed the necessary committee. Thank you, Nanot.
So it seems like every country has the laws that strengthen multi-sectoral collaboration, and in each law provide a mechanism, committee or commission, multi-sectoral committee to work on specific issue as speakers mentioned. I would like to go to my last question. Since you have a multi-sectoral mechanism, how do you handle conflict of interest when you work across sectors?
Yeah. Oh, okay, Nanot. Yeah. And how to avoid the conflict of interest is currently the ministry using especially for procurement. So the financial rule and regulation very rigid. So, but if there is an emergency condition, we need to overcome. We need to remove the red tape. So, but some area is we cannot overcome. So, in which we request to some business body. For example, like we have the pharmaceutical and medical business committee. So now where we request to this committee whatever we need, whatever we would like to buy, starting from the PPE to up to the medical equipment like the ventilator. So they use the principle and the platform. So there is one of the example to avoid the conflict of interest. So and also we have so many the mechanism that currently to avoiding the conflict of interest. So another thing is we developed the expert committee. For example, like the plasma replacement committee chaired by one of the radar professor expert in this field, and also the clinical consultation meeting chaired by the previous head minister, the Professor Tommy, and also the similar advisory committee we formed. So we are listening, or always we request their suggestions, their comments, and based on that we do the necessary decision. This is the current the mechanism to use the Myanmar. Thank you, Nonit.
And for Bangladesh, please.
Some amount of conflict of interest is always there. It is prevailing in all society, all countries, starting from the most developed and the developing countries. But we shall have to have the commitment for our population, commitment for the citizens, and you shall have to have the sanctity regarding your health ground, as because you should not earn any interest out of people's life. So this is the basic morality, and basing on this morality the society runs, and the government has rules and regulations to overcome this sort of conflict of interest. But it is there, as because this sectoral and this ministerial, they have their own interest, as because the cabinet, they are the highest. They are maintaining the minister's profile. And the health ministry, they are controlling the health sector and the doctors and the other people. Equally, the law enforcing agency, they have their own interests. So there are a lot of conflict of interest and it will be there. But if we work multi-sectoral, in open mind and in a democratic way, so there is open-mindedness, and we can ventilate our emotions, and we know this is a very crisis condition, and in a crisis condition, no place of any conflict of interest. Here, people used to do their with the enthusiasm and lot of benevolence and not of perfectionism. And I think this standard of moral, this can overcome and overrule these sorts of practice of conflict of interest. So I think it is very less in this COVID situation, as because this is a very sensitive issue. I think this is very, very minimum. And the committee, it has taken the people and it is maintained as because all the sectoral heads and the people choosing by what we call that by choosing from the good people. So here it is minimized, and I think in our place, the multi-sectoral approach, by selecting these good people in a good environment, it could be overcome very easily, and we are working in a very good harmonious situation and harmonious condition with the legal and the policy frames, and we are very happy.
Thank you. Can I go to Thailand, please? How to handle conflict of interest?
Okay, of course, the conflict of the partner usually happens in the COVID crisis as well. In Thailand, in the first phase of the pandemics, health security and disease control is the main objective. That we sacrifice freedom of movement, sacrifice to close the shop, close school, business, and lose job, income, something like that. This is a conflict of the economics and health, but we choose health security in the first priorities. Now we move to the recovery phase. We have to balance. We cannot stick on any intervention to make a zero case, new case. Sometimes we must allow the new case emerge with the healthcare facility can be responded. Balance with the economics and open the country. That is the conflict is usually happens, but if we have the platform of discussions and common goal together. The first one we choose health. The second one maybe we balance health and economic, something like that. Yes, for Thailand, I think this is sometimes so-called the conflict of interest management. Thanks.
Thank you. I think we quite run out of time because it's almost 6:30. We take almost 2 hours. And our discussion is very rich, so I cannot summarize the whole discussion. So I would like the speaker to give your last message or take away message on multi-sectoral collaboration on this point. May I ask Professor Rabbani first? Could you unmute your microphone?
Can you hear? Can you hear me?
Yes.
Yes.
Yes, please.
The take-away message is many, so I cannot elaborate, but the pinpoint message is that the multi-sectoral collaboration mandatory for sustainable development during COVID crisis and for any other future crisis. Engagement and collaboration of the non-government and government ministries and various sectors are relevant stakeholders are proven to be effective in crisis situation such as COVID and more crisis if comes in upcoming. Multi-sectoral collaboration has been a beneficial and such as increasing access to resource, sharing responsibilities, and strengthening ownership of the activities by stakeholders. And last of all, engagement of multiple sectors creates new knowledge, expertise, and resources, which is benefiting for producing better outcome in developing a harmonious and very peaceful society development in crisis situation. Thank you.
Thank you. May I go to Dr. who would like to be the second person between Dr. Weerasak and Dr. Kyaw Khan? Who would like to go first? As a moderator, Dr. Weerasak, you can go first.
Yes, for me, for the take-home message, I'm thinking of three things. The first one is the COVID crisis management is our witness to prove that multi-sectoral collaboration and action is existing. The second one is that the government policy can be implemented effectively if the other sectors are allowed to share, to think, to design, and then synergistically to implement it in sense of their belonging. The third one, the last one, we need platform to support and learn, and the social have to learn how to have the multi-sectoral working in advance, not only when the crisis comes. That is the message for me.
Thank you. Can I go to Dr. Kyaw Khan, please?
Yes, Nanot. Yeah, the COVID response is like a marathon competition, so that we need to keep our the relationship between the different stakeholders, especially the multi-sectoral area, so that we should remove anything necessary that would do the friction amend ourselves. So our main the intention is we always share that all the important issue in time to the implementing partners and all the stakeholders, and we always listening to their the comments and their suggestion. We are sitting in the steering chair, but we never decided without consultation with the expert committee and also without listening of the echo from the community group, and also without listening from the implementing partners. So there is an importance for the sustainability of the multi-sectoral collaboration in the long run. Thank you, Nanot.
Thank you. Thank you very much to all speakers for your time in sharing your wisdom and your experience. And I think everyone here had a great time with all speakers. And I believe that the audiences will learn from you as well. And I would like to thank audiences who stay with us until the end of the sessions. May I give the last announcements that we already give you a Google evaluation form on the chat box, and we will send it to email as well. So we would like you to give us a feedback on this webinar so that I will improve it next time. And I will have a webinar report will come out early October. So please follow up on our website, and hope we are still keep in touch. And one day that we don't have COVID-19 anymore, we will meet face to face again. Thank you very much to all. Bye.
Thank you, Nanit. Bye-bye. And the speaker from the Bangladesh and also the Thailand, and also the organizer and every responsible person. Yeah, bye-bye.